When this crisis started, the priorities of the European Union were twofold. At the time, we wanted, on the one hand, to address the health impact of COVID-19, and on the other hand, its socio-economic impact. In the Pacific, we have been fortunate enough to have a very limited health impact compared to other regions in the world. But of course, the socio-economic impact of the COVID-19 pandemic is felt very, very hard in all the countries we cover. With this agreement, the European Union contributes 20 million euros. It's a significant amount. It will serve to strengthen the health systems of Pacific Island countries, to allow them to face not only the challenges of COVID-19, but it's the first point I want to underline, to face any medical challenge they will encounter. This is a support to structures and systems and institutions. This is not just a one-shot. The second point I would like to underline is this is a part of the growing support from the European Union to health issues in this region. It started in December 2019 when a team from Europe was dispatched to Samoa to assist with the humanitarian crisis generated by the measles epidemics at the time. It continued last year when I had the pleasure of hosting already the World Health Organization and the Pacific Community for the signing of an agreement already to strengthen health systems in the tune of 18 million euros. So we're happy to increase our support to health systems in the Pacific.
I'm absolutely delighted to be here today to mark the signing of the agreement between the EU, WHO, SPC and WFP. As mentioned under this agreement, the EU is giving about 24 million US dollars to a number of Pacific countries to prepare and respond to COVID-19. This support is actually coming to fill up some gaps we had until now into the phase 2 COVID-19 Pacific preparedness and response plan. So this is extremely useful and valuable money because we had a plan and some still gaps into the financing of this plan. This plan was developed by the Joint Incident Management Team, as mentioned by Sujiro. And so it's really a joint endeavor to support the entire Pacific countries. So it will help us with a number of activities, from developing emergency operating centers or supporting the development of emergency operating centers in Pacific countries, but also supporting risk communication, engagement of communities and so on. It will also help us to support the preparedness to the rolling out of the vaccines. As you know, the COVAX facility has been established to provide or to support the development of vaccines, but also to support equitable distribution and access to vaccines. So this support that we are receiving from the EU is extremely valuable in that sense that it will help us scaling up the preparedness for the vaccine rollout. But I would like just to mention that the vaccine will not be and are not a magic bullet. And I want to emphasize that point. Vaccine, of course, a tremendous tool. But we can't expect to have all vaccines to vaccinate everyone in one go. So it means that what we call the non-pharmaceutical interventions will still to have been implemented. So hand washing, hygiene, and so on. All this physical distancing, wearing of masks in the countries where there is community transmission will have to keep going.